Hi, everyone. Thank you so much for tuning into The Open Mind, a lecture and film series that brings together thought leaders at the intersection of science and culture for meaningful and relevant programs about mental health. The Open Mind is proudly sponsored by UCLA's Friends of the Semel Institute for Neuroscience and Human Behavior and the Resnick Neuropsychiatric Hospital Board of Advisors. I'm Vicki Goodman, and it is my honor to welcome Dr. Thomas E. Brown, the author of the new critically acclaimed book, Social Anxiety: Hidden Fears and Shame in Teens and Adults. In his book, Dr. Brown explains that social anxiety is common in both adolescents and adults, but it's rarely treated and can often affect friendships and lead to loneliness and depression. Written with a colleague and just released by the American Psychiatric Association Publishing, Social Anxiety offers 22 case vignettes that highlight 11 adults and 11 teens who have various types of social anxiety, as well as related conditions such as ADHD, depression, or autism. Dr. Brown is a clinical professor of psychiatry and neuroscience at UC Riverside School of Medicine. He earned his PhD in clinical psychology at Yale and then served on the clinical faculty of the Department of Psychiatry at the Yale School of Medicine for 20 years, while operating a clinic in Connecticut for children and adults with ADHD and related problems. In May 2017, he relocated to California to be closer to his grandchildren, and he opened the Brown Clinic for Attention and Related Disorders in Manhattan Beach. He's the author of 7 books on ADHD with translation in 12 languages, and his 28-minute video on YouTube, What is Attention Deficit Hyperactivity Disorder, has received more than 9 million views. We are also honored to welcome back to the Open Mind Dr. Liz Laugeson, one of our very favorite UCLA faculty discussants. Dr. Laugeson is a clinical professor in the Department of Psychiatry and Biobehavioral Sciences at UCLA's Semel Institute, and she serves as director of the UCLA Tarjan Center, a university center for excellence in developmental disabilities. She's also the founding director of the UCLA Peers Clinic. As the creator of the Peers Social Skills programs, Dr. Laugeson has pioneered evidence-based treatments for individuals from preschool to adulthood, focusing on friendship, dating, and employment. She's authored 5 books on social skills and trained tens of thousands of professionals, educators, and families worldwide. Her Peers program has been translated into over a dozen languages, implemented in more than 150 countries, and is considered one of the few empirically supported social skills curricula for neurodivergent youth across the globe. So you can see we are in very good hands this evening with Dr. Brown and Dr. Laugeson, and on behalf of both the Friends and Resnick boards, I'd like to thank them both for taking the time from their busy schedules to educate us about social anxiety and give us some tips on how to manage it. Now, before I turn the program over to them, a few housekeeping notes before we begin. Today's program will run for approximately 1 hour, with the last segment reserved for your questions. If you would like to ask either of our speakers a question, we ask that you please type it into the Q&A located at the bottom of your Zoom screen. We have over 1,900 people registered today, so we appreciate your patience, and we will try to get to as many questions during the time allotted. Today's program is being recorded. You will be able to view it starting tomorrow on the Friends of Semel website. That is www.friendsofsemelinstitute.org. There you will also find videos from past events, information about our Teen Advisory Council, our Research Scholar Program, and a calendar of upcoming Open Mind programs. I would like to take this opportunity to highlight a very special program, our Open Mind Film Festival for high school students, now in its 5th year. It will be held in person on Sunday, April 27th at 1 p.m. at the James Bridges Theater at UCLA. We hope you will join us to meet the talented young filmmakers of tomorrow and watch the 13 short finalist films that were chosen by an esteemed panel of judges from over 300 films submitted by high school students throughout the country. The festival is free, but registration is required. Again, you can find it on our website, friendsofsemmelinstitute.org. And we thank you in advance and hope that you will attend this unique and wonderful event. Now, let's all get a little smarter about social anxiety. And please join me in giving a warm Zoom welcome to Dr. Tom Brown and Dr. Liz Laugeson. Thank you so much.
Well, thank you, Vicki. Hi, everyone. It's so nice to be here today. I want to start with giving a big thank you to Vicki Goodman, to Wendy Kelman, and all of the Friends of the Semel Institute for organizing this Open Mind event. We're really excited to have Dr. Tom Brown with us this evening. You might know him from his work on ADHD and executive functioning, but today, as Vicki mentioned, we're going to talk about something a little different, but just as important, and that is his new book, Social Anxiety, Hidden Fears and Shame in Teens and Adults. Personally, I've known Tom for several years and have had the pleasure of presenting with him at various conferences. I'm a big admirer of his work. I even had the opportunity to read this wonderful book last summer before it was even in print. Thank you for that, Tom. And it's lovely to now be able to talk with you about your latest work, and also welcome you to the Open Mind.
Thank you very much. I'm happy that we're here together.
Absolutely. This book is it's such an eye opener. It kind of looks at the quieter, often overlooked ways that social anxiety shows up in people's lives, from kids and teens to adults, and how deeply it can affect things like self-esteem and relationships and just daily life. And Tom, I tell you this all the time, but it's worth mentioning again, you are such an amazing storyteller. One of the things that I think you do so well in your writing is to blend real stories, science, and like practical insights. And in this case, to help us really see what social anxiety looks like beneath the surface. And so I think maybe to kick things off, with the most maybe natural place to start would be kind of the inspiration behind the book. So why did you decide to write this book on social anxiety, and why now?
I decided to write the book because although I see patients 5 days a week, most all the day, uh, and some of them are little kids, some of them are teenagers, some of them are adults, and some of them are elderly adults. Uh, I have found as I get to know them a little bit better that many of them will tell me, there's one thing that I didn't mention before, but I worry an awful lot about what other people think about me. And for some of them, it's a huge deal.
Yeah.
And as I listened to their stories and began to appreciate the various ways in which people have struggled with that, it just seemed to me it was important to try to, tell the story and get it out so that other people could see that they're not alone. None of us are alone with our worries. All of us have a certain amount of social anxiety, and for some people, it's overwhelming.
Yeah. And as you said, it often is so hidden.
Yeah.
It's not so obvious to everyone else. And you talk about that a lot in this book, the hidden fears and the quiet shame. Um,
Hmm.
why do you think that social anxiety often goes unnoticed, especially in teens and young adults?
Because they're very careful not to disclose it.
Yeah.
The fear is that if people knew these things that I worry about,
Mhm.
all of us certainly have the experience of how does it look what I'm wearing today, or what I said in the meeting. Did that make any sense?
Right.
That's just normal social anxiety. But the fact is that for some people, it's not just normal old social anxiety. It's very persistent worry
Right.
about being disgustingly fearful
Mhm.
and feeling like nobody else is feeling that way. because most people try to you know, conceal it as much as possible.
Yeah. Yeah, related to that too, in your book, you emphasize that many people with social anxiety delay treatment for
Well,
years.
yeah, and that's not just a little bit. This is something which, approximately, depending on which study you look at, about 12 to 14% of people in the general population of the United States have social anxiety. That's a lot of people.
Yeah.
However, the thing which is remarkable about it is that for some people, it's really intense and rarely spoken about. Because what we're talking about now is not just being a little bit nervous about how my outfit looks or about whether what I said makes any sense, but it tends to be intense, it's persistent, it's not easy to shake it. It becomes a matter of what would my parents think if they knew this about me? What would my spouse think? What would my son or my daughter think? What would my friends think if they ever knew some of these things that I've done or some of these things I've thought about? And it's dealt with as something that's a terrible secret.
Yeah.
And the studies that have been done on this tell us that the average length of time for people bringing it up in clinical context is 15 years.
Wow.
If somebody has panic attacks or they're having trouble with their excessive drinking or they're really severely depressed, they don't usually feel that they have to keep it so secret from everybody.
Yeah.
Social anxiety becomes something that people are quite ashamed of.
Yeah. Like a secret epidemic, that,
Yeah,
yeah.
but
Well,
the fact is that a lot of people don't know how many other people have it.
exactly. I think that actually this conversation is going to hopefully help to normalize this experience a bit more.
Well, I hope so for the people who are here to listen.
I hope so too.
Yeah,
I'm
and
curious to know what you think, Tom, about, what are the most common barriers that you've seen to seeking help? And I guess I asked the question because if we see the barriers or we anticipate the barriers, then maybe it makes it more likely that we break the barriers. So is it the stigma or what is that's getting
I
in
think
the way?
it's a feeling of embarrassment and shame.
Mhm.
Like nobody is proud of having panic attacks or of being depressed,
Mhm.
but people who have these difficulties usually are not afraid to mention it to people they trust.
Mhm.
And there's some aspects of social anxiety that seem to many people unspeakable.
Yeah. Yeah, it's so like we're in the social anxiety closet and lots of
Yeah,
people live in there, but we don't know it.
yeah. We don't know how many people are in the closet with us.
Right? Exactly.
Exactly. And it's highly heritable. It
Yeah.
runs in families.
Mhm.
If you have somebody in your family who has this and you're first degree relative of them, you got anywhere from 2 to 6 times the likelihood of having it yourself.
Yeah.
And the median age for it is someplace between about 13 years.
Mhm.
And a lot of people suffer with it for a lifetime.
Yeah. In your book, you mentioned the genetic predispositions,
Yeah.
and also the environmental influences. Maybe you could talk a little bit more about how early childhood experiences like parenting style, or peer interactions can also shape the development of social
Yeah,
anxiety.
certainly well, let me say something first about the heritability of it because that's something that we've got some interesting studies that have been done.
Mhm.
One of them in particular was they were looking at real young infants who were coming into a lab with their mothers, and I'm talking about 4-month-old kids.
Mhm.
Their mothers are there holding them from behind. And then there was a display of some unfamiliar movements and actions. And what they found was that in those kids who were being brought in for that brief exposure to some unfamiliar experience stimuli, uh, there were some who just freak out about it throwing their arms about and shouting and kicking and trying to do everything they could to get out of even looking at it. And that then they also found that when they were looking at the rest of the kids, that there were some kids who, well, they moved around a little, but it was no big deal. And then what was really interesting about it is they were seen for the first time at 4 months, and then they looked at them again at age 3, and they looked at them again at 7, and then at 10.
Yeah.
And what they found was those kids who were freaking out dramatically at 4 months, most of them were still exceedingly anxious kids at age 7 and more. The ones who just kicked around a little bit, but they weren't all that freaked out about it, tended to be a lot more willing to outreach and talk with other people as well. It runs in families.
Yeah.
There's a heritability factor in it, but there's also, as you mentioned, social experience. Think about what it's like if you grow up in a family where the other kids are riding their bikes, not just on your street, but down on the next block too. And you're living with a parent or parents who are saying, no, 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 you don't go into the next block. You stay right here where I can see you.
Mm-hmm.
If you're living with somebody who's constantly fearful of what the neighbors are going to think of you or about bad things that might happen, if the parents are not able to have you in their own eyesight at that moment, uh, it makes it seem like the world is kind of a scary place to be.
Yeah. Absolutely. I'm thinking about those little 4-month-old babies too, that kind of they just sort of come in almost hardwired already to sort of be
That's right.
emotionally reactive. And that kind of leads me to my next question, and where I'm going to get a little technical for a second with you, but I think it's going to be helpful to our audience. Individuals with social anxiety, they often experience these heightened emotional responses, right? Think of the
Yeah.
4-month-old baby, where they struggle to kind of regulate these emotions effectively. And you don't expect a 4-month-old to know how to regulate their emotions, and yet
No.
some sort of do naturally. And research, indicates that social anxiety is associated with difficulty with emotion regulation, especially in how we think about these feelings in the context of our social world. So, as a result, people with higher social anxiety struggle with not only interpreting their social world realistically, right, but
Right.
responding appropriately to these social cues. So, with
Mm-hmm.
that in mind, you talk about this in your book. Could you explain how your model of executive functioning relates to social anxiety, particularly emotion regulation and also what you call action monitoring?
Yeah, the model of ADD that I've developed is one that's got 6 clusters to it. One is being able to get organized, get started on stuff you need to do. Another is maintaining focus, not like you do if you're trying to fire a pistol down a target, but like driving, where you have to keep watch around a number of different things at the same time. And then regulation of alertness and sustaining effort. But then there are 2 other things that much more directly relate to this, and that is managing emotions. That there are some people where their primary concern is anger, that they get pissed off very easily and have a hard time letting it go. There are other people where it's what they want to get, their desires. Others worry a lot about bad things that might happen. And obviously, that's, the people who have a lot of difficulty with that are going to have trouble in managing those emotions.
Yeah.
And then being able to react to the stress without totally freaking out about it.
Yeah. Yeah, you talk about I feel like your discussion of action monitoring was really interesting to me in social
Yeah.
anxiety. And the way I sort of see that, just kind of as like following up with that, is it feels like this internal spotlight that's constantly turned on, right? It's
Yeah,
never turned off, and it magnifies like any small misstep,
yeah,
it makes social interactions feel like really high stakes,
yeah.
and probably really exhausting too.
Well, exactly, because they're on high alert.
Yeah,
There's some people who aren't paying that much attention to, how people are looking at them.
right.
And there are a lot of people who are very careful to try to observe every signal that they can get about what other people might be thinking about them, especially if it's something that's critical.
Yeah. Tom, as I was reading your book for the second time, because I read it last summer and then I read it again, in anticipation of having this discussion with you, I was thinking about my own experience with social anxiety. And,
Hmm.
I think social anxiety is an experience that many people can relate to.
Hmm.
And to highlight that, there's some of you might have heard this research before, but there's research that shows that 75%, approximately of people fear public speaking
Yeah,
more than death, right? Wow, that's incredible. 75% of people would fear public speaking more than death. And I'm not sure that I've ever feared public speaking more than death, but when I was in graduate school, and Tom, I think you know this, I definitely experienced social anxiety when it came to public speaking.
yeah,
I was the person in class who got really nervous when we had to give a presentation or introduce ourselves. And, I would be in my head, right? I'd be thinking about what I was going to say. And I couldn't even focus on what other people were saying because I was too worried about making a mistake
yeah,
or like
yeah,
a misstep.
exactly. And think about how that happens in a variety of things. For example, there are some kids who uh, are terrified at getting up to bat when they're playing baseball with their friends,
Mhm.
or are terrified of getting up and having to give a brief report, or the teachers ask them to go and put a problem on the chalkboard.
Yeah,
At any time they feel like others are going to be looking at them. There are
right.
many people who could care less. And
Mhm.
there's some people who just get very nervous about that kind of thing.
Yeah, and I think it's so, so common. And it was
Yeah,
funny, like in again, kind of reflecting personally about that. If you told me in my late 20s that I'd now spend a significant amount of my work week engaged in public speaking, I'd say you're crazy. Like
yeah, right.
that
That's
was
not my
never
stuff.
gonna happen. Yeah,
Yeah,
it's imagine. But I think that it's preparation and practice over time that can actually sort of change the
yeah.
dynamic.
And for some people, they can do as you have done, and that is develop the skills. And there are other people where it's very difficult. And there's
Yeah.
sort of certainly critical times. Take one when I was talking with the people I wrote about in the book. One of the things that I heard from a number of them is how uncomfortable they felt in when they had their rapid growth spurt in puberty.
Mhm.
The
Yeah.
girls who had early breast development
Mhm.
often spoke about how they had to wear certain kinds of shirts to be able to not have it show that much.
Yeah.
And the boys who had to change clothes in the locker room,
Mhm.
talked about how they had to turn around and get it so that other kids would not see how the size of their genitals compared with the size of others. And of course, there's the whole thing of how tall am I compared to the other people in the hallways in the school.
Yeah. Yeah. I mean, your book highlights a number of really eloquent case studies. It's one of my favorite things about your books is that, you're this great storyteller. So, from Sam to Patricia, like I feel like I know them. That's the storyteller in you. You share these poignant stories though of people struggling with social anxiety from different ages and with
Yeah,
different experiences. So maybe for those in our audience that haven't yet read your book, and I'm saying yet because I think they're going to want to, can
okay.
you just,
Yeah,
share?
let me mention a couple of them.
Yeah.
This is Sally. She's 15 years old. She just finished ninth grade in her first year at a pretty competitive high school. And the school had put her on academic warning for poor grades, resulting not from low test scores, but from not completing enough of her homework, in spite of the fact that her mother was reporting that she was up late at night doing homework. And it turned out that when I had a chance to talk with her about it, what she said was, I have to type all my notes. And I said, what do you mean, type all your notes? She said, when I write my notes from what the teacher's saying in class, I don't like the way they look when they're just handwritten. And so when I get home, I type them so that they're perfectly typed. And she was a good typist, uh, typed all those class notes. And by that time, then there wasn't much time left to actually do the homework.
Mhm.
And she was a very bright kid and she really tried it hard. This is another one. There's a 16-year-old guy named Mike, 10th grade. Parents were very concerned about how he got low test scores, and it was tried on some different medications for it, but they made him kind of jittery and he was uncomfortable with it. And he told me he did when I saw him privately after I met with him and his parents together, that, well, I'm glad you gave me a chance to tell you something that you're not going to tell them, and that is, uh, I'm I'm smoking weed almost every single night. And he said, but I felt pretty comfortable doing it after I found that my parents had a stash of weed in their dresser.
The apple doesn't fall far from the tree. Is that what we're
That's
saying?
right, but it was not discussed in their family.
Yeah.
There's a Daniel, a 20-year-old guy. He said, I said, I know I've got ADHD, but I think there's something else that makes me awkward with other people. I'm always anxious about what others might be thinking about me. I never know if I'm going to be too different from other people. He said, I finally got up the courage to have sex with a girl. It was okay, but then I couldn't think of anything to say after we finished. I just took her home and dropped her off. I wonder what she thought of me.
Probably not wanting a second date after that.
Yeah, right. And this is a girl who's 25 years old. She said, I've earned a lot of credits in 3 different colleges over the past 5 years. I still haven't met the requirements for a degree. Asking questions in class is scary for me. I got a job as a helper in an animal shelter where I helped feed and care for dogs. I loved what I was doing. I like animals more than I like people. One day, my supervisor seemed critical of my work. I shouted at him and he fired me. Then I felt really depressed.
Yeah.
These, and it's not just, let me just do one more. It's not just little kids. I have in my hand here the story of Patricia, who's 52 years old. She graduated from a competitive college and was very successfully employed as an administrative assistant in a large corporation. That position ended 2 years before she met with me because her company moved to another state. She and her husband didn't want to move. She received a strong reference letter from her boss, but in the 2 years she had since that time, she did nothing to seek a new job. And I asked her why not, and she said, well, I know he wrote a lot of nice things about me in that letter, but any potential employer would just see I'm too old and too fat. And it took a lot of talking for her to get to the point where she was ready to go ask for another job.
Yeah. Yeah. I mean, one thing I'm hearing as you're, recapping some of these stories is that social anxiety isn't always the only thing going on.
No,
We know.
very often it's something else. And I should say, most all of the people I'm writing about here came to my clinic because they had ADHD.
Mhm.
And it just took a while for me to get so that I was asking enough questions about it that they would be willing to tell me about what their experiences were with the anxiety.
Again, it's hidden, right? So,
Yeah.
decades of research show us that social anxieties, often what we call comorbid or co-occurring
Oh
with
yeah,
like
absolutely.
like ADHD, with the depression. You mentioned substance use, and you write about that in your book. You just shared some stories. I wonder if we could maybe expand on that a bit and talk about how these co-occurring conditions complicate diagnosis and also treatment for social.
They complicate it in several ways. One is that you have to deal with the problem of drinking too much or whatever the other specific thing is in addition to ADHD.
Mhm.
but then on top of that, they are ashamed of what they think about.
Yeah.
And let me tell you another thing about this, and that is that I've had a number of patients who told me that they were ashamed about their thoughts.
Mm.
And I was talking with one Roman Catholic priest, and he said, "Yeah," he said, "you know the word scrupulosity?" I said, "No, what does that mean?" He said, "Those are people who have powerful scruples and
Mm.
can imagine all kinds of ways that they've been offending God by various thoughts that they've had in their head."
Yeah.
And he said that a number of the people that came in to confess their sins were taking a very long time to do it
Mhm.
because they were so scrupulous
Yeah.
about, oh, and I thought about, I saw this porn thing and what these two people were doing together for sex. And it was kind of weird, but I was fascinated with it. And I probably watched it 15 times.
Mhm.
That it's not just what you say or what you do, but it's also what you think about
Yeah.
for people who have social anxiety, even
Almost
though
like
it's
your own
privately
personal mind
social.
police.
I'm sorry, I didn't hear you.
Almost like your own personal mind police, you know?
Right. Yeah. It's like you got a cop in your head saying,
Yeah.
oh, no, 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 you shouldn't be thinking about that. What's the matter with you?
Yeah. I mean, that is exhausting. It seems exhausting.
Sure, it is. And there's some people who have just a little bit of it, and there's some people who have a lot of
Yeah.
it. And then some other things like think about what it's like if you're in a school where all the other students mostly are black
Mhm.
and you're white,
Right.
or if you happen to be one of a few blacks in this dominantly white school.
Hmm.
Or think about what you're doing if you happen to be, this is a problem for a lot of the lesbian, gay, bisexual, and TQs, uh, the self consciousness
Yeah.
of what people say, even if they don't know that you happen to be one of that club.
Yeah.
And there's something else that took a while for me to get this from some people, but there are many people who are married to each other and have been married to each other for years, but don't feel that they can safely talk about how they feel about what the other partner is doing sexually. That if they wish that something else could be a little different,
Yeah.
it would be nice to be able to discuss it. But the fact is, uh, for many people, it's not easily discussed.
Yeah. To kind of get back to what you were talking about, you write about minority stress, and you just
Yeah.
referenced that a moment ago. And that includes, racial or even LGBTQ plus, identity, intensifying social anxiety. And I'm
Sure.
wondering, how clinicians might be more culturally responsible in their assessments and their interventions with these groups.
Well, some things, and for example, talking with people about how they think other people in their family or other people in their school or other people in their workplace.
Hmm.
What are the comments people make?
Yeah.
Who, not knowing perhaps that they're coming about something that's part of their world.
Hmm. Yeah.
It's a tough situation. And the fact is that it's very widespread.
Yeah. Well, yeah, you just also mentioned, in relationships and, um, in your book, you also talk about how sexual performance anxiety and, even anxiety about one's thoughts, which you mentioned a moment ago, can be very problematic. And how do those more private forms of social anxiety impact relationships and even self-concept?
They're often kept more quiet even than the other examples we've talked about.
That's what I thought you'd say.
Because the fact is that some of these things, it's like they may be married, they may be having sex together, but they don't feel like they can say something they'd like to see change in their partner's behavior. or they're not able to listen very much to what their partner thinks about what they're doing sexually.
Yeah, I mean, it's very taboo, right? Even in a relationship with someone, people aren't
Well,
always,
yeah, and the fact is, it's not something that's readily spoken about.
yeah, yeah.
And so sometimes it's your private thoughts
Mhm.
about, and there's some things in a marriage or any long lasting or interpersonal relationship which people feel quite comfortable in saying, for God's sake, why do you keep doing that? Or if only you would try something better to say when you have something like this to say. But there are some things where no,
Yeah,
it's unspeakable.
right. Well, I'm going to shift gears, now, and we've talked a lot about how social anxiety manifests itself and even explored some potential causes of social anxiety. So maybe in these last couple questions, we could be really solution oriented, right?
Okay.
And to start, I'd like to talk about diagnoses. So,
Mhm.
what are some of the most promising tools for assessing social anxiety in teens and adults?
Well, one of them is simply for the clinician who's talking with the counselor or clinician who's talking with them to give some examples of some of these things that people often have problems with in a spirit that says, I don't know if it's you, but let me just mention there are a lot of people who just get very nervous about what other people are thinking about them when they're having sex. Or what is it that makes it so difficult when you have to get up and put a math problem up on the board?
Mhm.
Or yeah, it's true that you might be really good at all things academic, but you're telling me that you hate going to gym class. And I ask you about why, and it's because you're not able to throw the basket up and hit the basketball into the hoop.
Yeah.
Or you feel klutzy when you're trying to do the forward roll or backward rolls on the mats, that most of the other kids just walk right up and do it and enjoy it.
Yeah.
To give some examples of how various people experience their social anxiety, can prime the pump.
Mhm.
If you give some things as examples that for this particular person might be an issue.
Yeah. Kind of normalizes the experience too. If you can give
Exactly. So
examples.
they can understand that, yeah, that's something a lot of people have.
Yeah. Yeah. Well, then in terms of treatment for social
Yeah.
anxiety, maybe you could talk a little bit about what distinguishes approaches like cognitive behavioral therapy from, medication use or from, social skills programs like peers. That's the program that I've
Mhm.
developed. How do you decide which treatment is the best fit for a particular client, including with the complexity of like all these comorbidities and co-occurring
Right, where there half a dozen different things going on all at the
Yeah.
same time. Sometimes it's a matter of talking about possibilities
Mhm.
that, for example, uh, running some examples of the kinds of things that are embarrassing to people who are first getting used to having sexual relationships with other people, or how to talk about uh, the fears that you have of or your heart's pounding when the teachers they're about to ask somebody to get up and say what they thought of the reading assignment today. To just give some examples of things that are difficult, and then can say, are there any things like that sometimes you worry about more than you think you should have to worry about?
Yeah.
And there are some people where it's just a relief to be able to talk about it and normalize it, and to get a chance to see that, yeah, this is not just me.
Mhm.
And there are other people where these fears are so intense
Yeah.
that we might need to use some medication in
Mhm.
order to take the edge off it.
Sure.
But I think a good beginning is just giving some examples of things that might be problematic for this particular person
Yeah,
and
and
asking them to give me some more examples of
right. And maybe like identifying their social goals or what treatment goals they have in terms of prioritizing sort
it.
of
Yeah.
where to go next.
Well, like what would you like to be able to change about yourself?
Yeah, right.
Why is it that you get invited to a lot of parties and then you don't want to go?
Yeah. Maybe they want to have a relationship, a romantic relationship, and don't realize that the social anxiety is getting in the way or
Exactly.
yeah.
Yeah.
Um, all right. Well, I see Vicky rejoining us, so I'm gonna pass the virtual mic back to Vicky Goodman in just one moment for a Q&A. But I would like to, just end with thanking Dr. Brown for sharing your time and your insights with us. And I think this conversation really brings to life just how complex and how common social anxiety can be. And I think your book really gives us a deeper understanding of the people behind the diagnosis
Yeah.
and perhaps even more importantly, what we can do to help. So, thank
Thanks,
you,
Liz.
Tom, for giving me the opportunity to geek out with you for these 45
Yeah.
minutes. And I'll turn it back over to Vicky. Thank you.
Thank
Thanks.
you. Thank you both. This was a fascinating discussion, and you gave us so much insight into social anxiety. And we have a lot of questions, but before I get to them again, I want to just thank you both for taking the time to be part of this open mind discussion. Tom, for writing this book so that those of us who live with social anxiety understand it better and have some idea on how to manage it. And going to the questions, we have a lot of questions about supporting a young person who has social anxiety. What's the best way to support them, to approach them about it when kind of have the feeling that this is what's happening? What would your suggestions be? A number of our listeners are asking that.
Well, one of the things is that many times kids criticize other kids for things that they themselves have problems with too. They make come home talking about how stupid this kid was in talking about how he was nervous about doing this or that, or that and to be able to then say, well, had you thought about what it feels like to be him? Or
Talking in someone else's
to
view.
just sort of give examples of this and normalize it. That different people worry about different stuff, and there may be some where just reassuring them will be helpful, and there might be some others where you can try reassuring them, but they're not able to be reassured very easily because there may be other things that are behind that. It's like this is something that I can mention to you a little bit, but there are things behind it that, oh no, I wouldn't be likely to talk about that.
We have another question here. Liz, did you want to add anything to that?
Um,
Supporting.
I'm here, so I'm certainly happy to answer any questions, but no, I think Tom covered it very nicely.
All right, we have another question here from a viewer. Are you saying, Dr. Brown, that social anxiety is a marker for ADHD?
No, what I'm saying is that I run a clinic for people with ADHD. One of the things that most clinicians know is that you very rarely see plain vanilla ADHD. That most people who have ADHD have something else with it, depression, anxiety, whatever. Uh, but it's not that the ADHD causes the social anxiety. It's that these people that I was writing about were people whom I was seeing in my clinic for social anxiety, for ADHD, which is the primary ticket that most people use to get in. But then, as we talked about it, I try to create a climate where it's safe to admit things that are kind of hard to acknowledge. And that's how people bring it up for me.
Where is the point when you decide that medication is appropriate? So you touched a little bit about medication, but just slightly. So could we look at that a little bit? And
Yeah, well,
what medications are there?
Well, there are a number of anti-anxiety medications. You don't want the kind where they're easy to get hooked on. It's more like there's several of the medicines that are approved for dealing with social anxiety are also medicines that are used for dealing with depression and chronic anxiety of other kinds. And just small doses that you let people do for a while. But I also have am reluctant to use just medicine to help to deal with this. I think it's important to get people to talk with the clinician about the examples they've had this, and many times kids. I was thinking about one girl who, a high school girl, who said that she was, very conscious of how boys talked about girls, and she was in the lunchroom, and there were two boys talking with each other about how this one girl was such a prude that he'd been cuddling with this girl, and then he just stuck his hand down into her pants, and she shrieked and just said, "Take me home." And the two boys were sitting there shaking their heads, saying, "Oh, she's such a prude. She's such a prude." And it was, what the girl was saying to herself. She didn't want to well, she wanted actually to say it, but she didn't say, "You guys are so screwed up to think she's being prudish. You're just amateurs at knowing how to make out."
Now you're getting into a whole nother territory, permission and so let's stick with our social anxiety here. We have a question here about where can a young adult, 20 years old, college student who self-identifies as having primarily social anxiety, get a good assessment to tease out, is it social anxiety versus OCD, or is it an autism spectrum? And is treating the social anxiety a good place to start, or where do you get a good assessment?
You start with wherever they're willing to begin.
Okay.
And the fact is that in terms of autism, usually it's the higher functioning people on the autism spectrum that have more difficulty with this because they're out there in a much more mixed social environment. But there are some teachers who overhear kids talking about stuff like this and can be very supportive. There's some parents who are able to be very supportive if they hear their kids talking about this kind of thing. And sometimes just saying, "Oh my God, I had the same thing when I was your age." It's not that weird. Or why are you being so critical of your sister when she's talking about the way the boys that she was dealing with are dealing with her? And to try to encourage some empathy for other people who are suffering with the same problem, which at the same time is saying to them, it's not that bad if you have it too.
Well, empathy and kindness, long way to and support and understanding.
Right, but I think it helps to be able to be blunt about it.
Yes.
To be able to call these things by their right names.
Well, Liz, I know you created the Peers program where social skills are actually practiced. And I'm wondering what you could say about when you are practicing and being prepared, how that can help social anxiety.
Yeah, one of the things that we screen for in the Peers program, which is a program that focuses on a lot of different social skills. We have programs around friendships, making and keeping friends, dating, finding and getting a job. But we screen for social anxiety because all of our programs are sort of group based. And if someone is too socially anxious to participate in a group, then it's not going to be a good fit. We want to treat that social anxiety first. So getting back to that question that was just asked of like, where, how do you get evaluated? And I would say, first of all, make sure that whoever you're getting evaluated by understands what social anxiety looks like and what it looks like in different people. It can look very different in someone who's autistic versus someone who has ADHD versus, so really important to make sure you're in the right place. But in these group-based interventions, we do a lot of practicing what are called ecologically valid social skills. We're preparing them. That's what you were asking, Vicki. We're preparing them to interact in the social world in a way that's kind of predictable, right? We're basically decoding the social world and trying to make the world as predictable as possible. Obviously, the world's not terribly predictable, but we're going to try to make it as socially predictable as possible. That involves a lot of practice. And what I think happens there is something that's called it's exposure with response prevention is the technical term that's used in cognitive behavioral therapy, where you introduce things that are feared to people in kind of these like little successive sort of, approximations over this hierarchy of like the least feared to the most feared. And we kind of do that a little bit in peers, not intentionally, that they weren't intended to be exposures, but really they are when you practice going up and starting a conversation with someone or entering a group conversation, but you go in and you're equipped with some tools. Sort of the roadmap, right? And you're practicing in the group first, and then you're practicing outside of the group. I think that preparation and that practice in combination increases a person's confidence. And the reason it's increasing the confidence, it's building up your social competence.
Yeah.
As we become more competent, we become more confident, we become less socially anxious. So there are different ways of approaching this. Yeah.
Well, we actually spoke about that in full disclosure when I first founded the Open Mind and had to get up and speak and introduce the speaker. I had such terrible anxiety, I could barely get myself up there. And the entire day I worried and worried and worried. So and now, having done probably 100 of these, maybe more, just the practice and has really helped reduce that. So I think
that you survived it before and now you can do it again.
Right. And I think that the practice gives you confidence that you can do it. So I think that's very valuable to keep in mind when you have.
But I think that it's also helpful with parents, and if their kids are criticizing to their parents or to other kids, that somebody is fearful and squeamish about doing things that they're doing. Sometimes the parents talking about, it's not that big a deal. Do you know that a lot of kids have exactly that same problem? And that doesn't mean they're stupid. It just means that some people are a little more shy than others. And they often get over it.
Coming from a parent, is that going to resonate with
It depends on how you say it.
How would you say it that it would have more of a chance of resonating?
I don't get why you guys are talking about that kid, what that kid said, as though he's such a dumbass. As though nobody else ever does that. I did things like that once I was that age. Your brother used to do that when he was your age. These are things that a lot of people struggle with.
Yeah. I think that, everybody's got a different style with how they communicate. Like you got to own who you are as a communicator. And for me, I would probably maybe start with coming from a place of empathy and maybe disclosure of saying,
Mhm.
I don't know if you ever feel this way, but I know that when I used to have to get up in school,
Yeah.
give presentations, I would get so nervous. I would blush. Sometimes I would like perspire. I'd be thinking in my head all the things I was supposed to do. I couldn't even focus. Do you ever feel like that? And like start a dialogue that way where it's like okay to sort
Yeah.
of disclose that. And then also share like, well, this is what's worked for me, or this is what I've tried. And like really come at it. I mean, again, it's the how you communicate. Tom like is funny. He's going to use humor. I'm going to come from like this place of empathy and everybody's different. But having an honest conversation and find a person on the planet that hasn't experienced some social anxiety. I mean, if they say they haven't, I'm skeptical. They
Yeah.
might be
They're
out.
lying.
They
Right.
might be out there, but they're rare. And so I think, opening up the dialogue by
Mhm.
normalizing it is a really nice way to start the conversation.
Sure.
Great advice. Great advice. Thank you both. We have just a little bit more time, and then we've had questions about using mindfulness techniques, breath work to help reduce that. How do you feel about those techniques? And do you feel they're helpful?
For some people, yes. For other people, you need a different route. And so, and a lot of times, many of the examples I've given had to do with parents, because there's some parents who are really pretty damn good at being able to encourage their kids to take a more empathetic view of what other kids are doing, or what their younger siblings are doing. That sort of thing, I think, can be very helpful. Or being willing to claim, as you know, both of us here today talking have said about how we've struggled with stuff like that too. I think that being willing to claim that is a gift.
It's empowering.
Yeah.
Yes, definitely is. Um, well, we are just about out of time, but we have a couple of questions here about how do we get this book? Where can we order it, Tom?
Okay. May I hold it up?
Of course.
It just says social anxiety, hidden fears and shame in teens and adults.
And can
And
you order it on most of the websites, the booksellers?
yeah, most of the websites have it. Amazon has it, and then it's published by the American Psychiatric Association Publishing House. But it's not a big long book. It's just like this. But I think the stories in it are helpful for a lot of people.
Well, I think this discussion was helpful for a lot of people. So thank you both, really for sharing all your knowledge and your expertise and giving us valuable tips on managing social anxiety and also normalizing it. I think,
Yeah.
it's, as you both pointed out, people don't want to talk about it. They're embarrassed, they have shame.
Mm-hmm.
And I think, I hope that everybody that tuned into this discussion, that it was helpful to reduce that. I know for myself, it certainly helped. So again, thank you both. And I want to thank everybody that tuned in to this webinar. I also want to remind everybody that the Open Mind Film Festival is happening on April 27th. And for those of you who do not live in Los Angeles or on the West Coast, our next online program will be on Thursday, May 1st. And our guest will be Dr. Deb Whitman, who is the author of The Second 50, Answers to the 7 Big Questions of Midlife and Beyond. And our own Dr. Helen Lavretsky, who at UCLA will be joining in discussion. So with that, I want to thank everyone for the privilege of their time, and stay safe, stay well, be kind, and have a lovely evening.
Thank you very much.
Bye.